Okay. Good afternoon, everyone. Looks like we have a nice turnout on Zoom. I'm Ramotzi Saunders, Interim Medical Director for Intensive Services, and filling in for Dom in the introductory role for today's Intensive Services Grand Rounds. We have two speakers today. Looking forward to hearing their talk. It's going to be Josiah Stickels and Kari Rogenski. Hope I didn't butcher your name, Kari.
You did great. Thank you.
And before we get started, I'd like to tell you a little about the two of them. So Josiah is a graduate of the California Institute of Integral Studies here in San Francisco with a master's degree in counseling psychology and a concentration in drama therapy. He's a licensed marriage and family therapist. He's a registered drama therapist and board certified trainer, and the current president of the North American Drama Therapy Association. He is also a representative of the National Coalition of Creative Arts Therapies and the World Alliance of Drama Therapy. He's the clinical administrator of our adult intensive services, managing the partial hospitalization program, as well as the intensive outpatient program, and in addition, rehab services of the adult inpatient program at UCSF Langley Porter. He specializes in using drama therapy in acute psychiatry. In terms of teaching, he has mentored practicum students. He also consults on the effective uses of drama therapy and has presented at past conferences. And a little more about his development here at Langley Porter. He completed his practicum many moons ago in an adolescent inpatient unit and worked at a dual diagnosis residential rehab facility before his current work at Langley Porter. Josiah began his career as a per diem therapist on AIP. I had not known that until reading this.
Yeah.
I have known Josiah since I started here in October 2018. He is awesome and highly competent, and I'm definitely looking forward to his presentation. And I'd also like to introduce Kari. She is a licensed marriage and family therapist and registered drama therapist. She's been the director of the Hummingbird project for the last 7 years, is co-creator of Joyful Moments, Meaningful Activities to Engage Older Adults. She's the president-elect of the North American Drama Therapy Association and a founding member of Reimagining Dementia, a creative coalition for justice. Kari is completing her PhD in psychology at Saybrook University in creativity studies with a focus on gerontology. So we have two extremely accomplished presenters for this afternoon's Grand Rounds. And without further ado, I hope we can give them a warm welcome and get started.
Great, thank you so much, Dr. Saunders. I hope that I can live up to such an introduction. So Kari and I are excited to be here to talk about drama therapy and how it can be used and is used in acute psychiatry and in the hospital settings. We're going to do our best to give a brief overview of the theory and practice so that people are more familiar with drama therapy. That was the intention behind making this a part of the Intensive Services Grand Round series to help familiarize people with drama therapy. Brief disclosure, Kari and I are not being compensated for this time. We are happy to be here. And myself, especially as this pertains to the work that I do here at Langley Porter, and is a nice combination of the work that I also do outside of Langley Porter with the North American Drama Therapy Association. Kari and I are affiliated with NADTA, a nonprofit, but have no other conflicts of interest. This series, as Dr. Saunders mentioned, and I don't think we had an introduction by Nicholas, our communications director, but this series is part of an overall series, grand rounds, to help educate clinicians and providers on really practical skills to use with our population here at Langley Porter. But we welcome audience members from throughout the university and invited guests. And Kari, what are we going to do here?
Well, thank you, Josiah, for the warm welcome and introduction. Just to give us context for our time together today, our learning objectives are very important, and we're going to cover a lot in a short amount of time. So we are grateful for your energy and your patience. So first, learning about basic drama therapy terms and concepts. Second, we're going to identify and share with you key drama therapy concepts, specifically related to 3 theories: the role theory, the developmental transformations theory, and the integrative 5-phase model. And then third, we're going to learn more about how to become a registered drama therapist and share with you our experience as drama therapists.
So we thought we would make this presentation as interactive as possible as we can on Zoom. So Kari had some suggestions for that.
Thank you, Josiah. So first, before we dive in, we wanted to share with you a little bit about our journey becoming drama therapists, which I think is really important as we share with you some of the skills and techniques that we use in this work. So just to tell you a little bit about my story, I found drama therapy when I was working for and volunteering with a community mental health agency back in a very rural community in southern Alberta in Canada, which is where I am from and where I grew up. I was pursuing my undergraduate degree in theater, and I was really interested in trying to learn about how I could apply my skills in theater to support people in the community. And I found myself volunteering and working at a local agency in the community that focused on supporting people living with mental health challenges. And I led a drama group, and I became very interested in how I could apply the work I was doing. And of course, just like anybody else, thought perhaps I had discovered drama therapy, the application of theater to supporting individuals' lives. And of course, all it took was a Google search to realize that the field of drama therapy existed. And that's where my journey began. And I found myself pursuing my master's degree at CIIS. Josiah was one cohort ahead of me. And so we were able to interact many years ago as students. And I have always had a personal passion in my work for working with older adults, specifically supporting people living with dementia. So I had the opportunity to do my clinical internship for my RDT and my MFT license over at CPMC. Where I was working in skilled nursing and then also in Alzheimer's residential care. And ever since then, the pure passion of my work has been bringing the creative arts therapies and drama therapy to people living with dementia through the Hummingbird project and the work that I do with that program. So Josiah, will you say a little bit more about your story, and then we'll dive into the interactive piece?
Yeah. Thank you. My journey to drama therapy was similar to Kari's. We both went to CIIS. How I discovered the program was I was working in student affairs, student life, managing housing and residential life at the Academy of Art. It's something I got into in my undergraduate work. I majored in theater in undergrad, was very interested in that. Been an actor, stage manager, produced a play or two. And when I saw the brochure in a theater rag on from San Francisco about drama therapy. I checked it out at CIS, was really intrigued by it, and then had already been wanting to deepen my work with in human services and I was already providing kind of peer support and supporting my residents. And so this was a natural fit and kind of flowed into my interests and where I felt like I was heading professionally. So that's where I got into studying drama therapy. And I think I'll leave it at that because my introduction was so long. And we can jump right into our first activity, Kari.
Amazing. Thank you, Josiah. So I'm just going to go ahead and pop this prompt and invitation into the chat box as well. Josiah and I are going to go ahead and model, and I invite you all to actively participate by answering the question and the prompt in the chat, if you will. So one of the ways that we work as drama therapists is, of course, using projective techniques by using things like storytelling prompts and ideas as means of a check-in. So, of course, you just heard us check in verbally and share our story. But now we're going to check in with our weather forecast to let you know where we're at today and what we're tuning in with in our story. So I will go first, and then I'll pass to Josiah, who will offer his weather forecast as well. And you are all invited to participate through the chat box. So my weather forecast today is a little bit foggy. It's that San Francisco fog where it's a little cool, it's a little drizzly, and yet there's something really cozy about it. I'm feeling foggy with a chance of thunderstorms, but the sun is starting to peek through and there are blue skies beyond the fog. Great. Over to you, Josiah.
Yeah, my weather is, you said thunderstorms. I was going to say lightning storms, but like the weather beforehand where there's lots of gray clouds above and there's those ions in the atmosphere and lots of static electricity, because I feel a little nervous about this presentation. So that's my weather forecast and introduction. And there I kind of modeled like my nervousness was I was using the verging thunder and lightning storm as a metaphor for my nerves of this presentation. So that would be an example of some of the work we would do in a group.
That's right. And I was sharing my thunderstorms peeking through as a metaphor for all of the things that were happening before I joined this call that are on hold in my inbox, because that's where they need to stay so that I can focus. And the blue skies to come are the hopeful piece of those clouds parting. All right,
Kari, nobody participated in our chat thing.
Oh, my friends, if you feel so inclined, I hope you will pop a little something in the chat. Don't feel like obligated to answer all of the questions. You are welcome to just answer the weather forecast if you like.
Yeah, the Zoom chat will already say your name, but why don't we hear if you're sunny weather, if it's raining, if there's a cloud following you around today, what's happening? I know, Kari, is chat disabled?
Oh, it does. It seems to be working.
No,
maybe
chat is open for everyone.
Oh.
Here we are. Thank you, Jennifer Gordon.
Because I know we have at least 2 drama therapists in the audience and some other creative arts therapies represented. So I would hope that at least they would participate.
So, well, here they start coming in, Josiah. And what I love about this is this is exactly how a drama therapy group looks and feels. We start with a warm-up, and sometimes warm-ups take a little bit of time depending on what's happening. And I also think it's important to note warm-ups can take longer in the virtual space than when we're in person, and that is totally a-okay. So Jennifer Gordon said, my forecast is humid, Midwestern, sultry summer afternoon, thunder rumbling in the distance. So I love this. Another sunny day in paradise. Very nice. Clear with a chance of rain. What else do we have? There's lots of juicy stuff in the chat. A little chilly, very busy day.
Warm and cozy. I like that
Warm
one.
and cozy. I like warm and cozy. Well, thank you all for participating. I really appreciate it.
Yeah.
And you're welcome to continue to contribute to the chat throughout the presentation. We hope that you will.
I also was going to point out that when you're leading a drama therapy group, the therapist is often kind of like the director. And Kari was mentioning really wanting to warm up the group. So if you noticed that an offering or an invitation that you gave to the group wasn't working, you might do some side coaching and try to get people to continue to engage in the group. So that this would be an example of some of the work we would do in a group itself. I wanted to talk a little bit about what drama therapy is, since we went straight into practicing it. But drama therapy is the intentional use of drama and or theater processes to achieve therapeutic goals. So both Kari and I and drama therapists are required to have a background in theater. So all of those techniques that we learned, those theater games we played, they're all informing the decisions we make, the interventions we use in the work that we are doing with our clients, with our patients. So drama therapy is an embodied practice. It's very active and experiential. I often say it's in comparison to talk therapy, instead of just talking about things, you're doing them. It's very active. You're often on your feet, moving around, versus just talking about your problems and concerns. We're still working on setting goals and trying to solve problems, express feelings, but it's a whole body experience. Through drama and depth and breadth of inner experience, through drama, all of the inner experiences can be externalized and then examined. So, that's one of the, I think, most powerful components of drama therapy, is that all of the things that are in our psyche, you can explore in an external way using those projective techniques that we gave an example of in that very simple warm-up. So in terms of what are the goals of applying drama therapy in acute psychiatry, either in the outpatient setting or in the inpatient setting, a lot of it is about helping the client, the patient, increase their sense of agency. So having control over things. When you're in a group and doing a scene or playing an improv game, the person is in control. They might not in their everyday life have as much control. This gives them an opportunity to practice being the one making the decisions, calling the shots. So increasing that sense of agency, giving them a space to practice it. Drama therapy promotes movement, but I would also add that we are very acutely aware of people's limitations or accommodations that need to be made. So I've had groups where there'll be a couple of people in chairs, or less mobile folks will be using various supports or choosing their level of participation. So movement doesn't have to be huge. It can be as simple as just using your hands. I know in Zoom we're using a lot of the space that we have available to fill up, and so we encourage people to use hand motions and facial expressions. So movement can be not as exaggerated as one might think of. It improves cognition. So we're working on identification, organization, tracking. It promotes mindfulness in that people really need to pay attention. I'm thinking of one activity of just tossing a ball around. Takes a lot of concentration. I often use that for a mindfulness activity, because if you're not paying attention, you're gonna get hit by the ball. And usually I'll pick something plush so that it doesn't harm you when you get hit. And then lastly, drama therapy promotes social interaction. It can be done individually, but the majority of the time it is a group experience. And so in that, it requires people to interact with each other and cooperate. They're building imaginary scenes, or the exercises are about mirroring your partner, or learning more about your partner and then coming back as a group, or making a cooperative story together.
So we wanted to take a moment to just share with you the origins of drama therapy. So of course, the theoretical foundations that are the launching point for drama therapy practice and theory include drama, theater, psychology, psychotherapy, anthropology, play, interactive process, and of course the creative process, which is something that I'm studying in my PhD right now. And I've been so inspired about how the creative process can inform all parts of our life. Next slide, please. And a little inspiration for you from the theater, from, of course, Oscar Wilde. Man is least himself when he talks in his own person. Give him a mask and he will tell you the truth. Next slide.
And I think that that quote about the mask is really important, because that's at the heart of those projective techniques that we use, that if participants are given something else to project upon some of the things that they're struggling with, they're more willing and able to talk about them, to explore them. Whereas if it immediately goes to personal material, it's harder to get at what's the real issue at hand. I thought I'd briefly just list out, and I won't have time to go over in depth, some of the specific influences that drama therapy has, but Stanislavski, certainly, Meisner, a lot of people have heard of the Meisner technique. These were all influences of drama therapy. Toad, Grotowski, Spolin for sure, did a lot of work with improvisation, with really interactive theater techniques and games, and you'll see those in most drama therapy groups if you witness them. Boal, certainly an important contributor to drama therapy, with the contribution of the spect actor. So really getting rid of the fourth wall and inviting the audience to be a part of the action, breaking that down in a new and inventive way. Bertolt Brecht, of course, and working on how the audience feels based on what's being performed in front of them. And then Moreno, Jacob Moreno was a huge innovator of psychodrama, which was kind of the predecessor to drama therapy, and very popular in the 70s in hospital and acute psychiatry settings. So if there's anybody in our audience who was in facilities and institutions around the 70s, probably witnessed a psychodrama group of some sort. It's still around. There's still psychodramatists. The rehab center I worked at had one that would come and do a psychodrama every week. Essentially, a psychodrama is a very prescribed and structured format of what you might see in a drama therapy group, but it has very prescribed participants. There's a way to enroll people within the group. There's a way of choosing what material is going to be explored. It's very also interactive, because the group is the one that's deciding who's going to work on the psychodrama for that particular group, and then they pick various group members to play pieces of the psychodrama. Interesting enough, since we have a lot of psychiatrists, psychologists, and therapists in the audience, Jacob Moreno was around the same time and area as Fritz Perls, developing the Gestalt therapy. And there's a lot of similarities in the empty chair work versus some of the psychodrama techniques that you see. A little bit of difference between psychodrama and drama therapy is psychodrama tends to focus on one specific protagonist versus drama therapy is more about the group, building group cohesion and helping the members of the group support each other and interact with each other. Psychodrama gets straight at real life experiences versus drama therapy builds off of more distanced material and gradually gets a person to explore more relevant current psychological material. Drama therapy has a wide variety of sources versus Jacob Moreno was the primary developer of psychodrama. Psychodrama, the current practice does not make full use of theater versus for drama therapy, there is really a grounding in theater.
So to just touch base now on process and technique as drama therapists, of course, we always begin working with the client by assessing their needs and considering the approach that needs to be taken. And we're going to touch specifically on 3 theoretical approaches in a few minutes here, but there are many more than that, which is important to know. One of my favorite things about being a drama therapist is that drama therapy can take many forms. So as Josiah mentioned, a lot of drama therapy process occurs in groups. I myself at the Hummingbird Project am focused on working one-on-one with older adults. And so we're able to dive more deeply into kind of storytelling, using improvisation for connection, using those creative processes I mentioned earlier. And that's what I personally love about being a drama therapist is that there's just, the toolbox is so large and there's so many things that you can pull from. The use of improvisation is an integral part of the theory. And I'm sorry that we won't have more time for that today, but it's something I really encourage all of us in healthcare to get familiar with. Alrighty, core processes, Josiah, back to you.
And if Kari and I sound like we're talking really fast, we did a 6-hour presentation for our latest conference, and we are trying to distill that down into 50 minutes or so. But core processes look at what are the functions of drama therapy and what is really working towards healing a patient or a client. And a lot of work has been done in that area by a drama therapist named Phil Jones, who really identified what are the core processes, the therapeutic factors that we would look at, especially when we're researching drama therapy and its effectiveness and what populations it works best with. But one of them would be dramatic projection. We kind of talked about that already. Personification and impersonation describes 2 different dramatic forms in which the client expresses his or her personal material in the form of a role play or an object. There's interactive audience and witnessing. So playing with the different roles of witnessing somebody else's material, but then also stepping into doing that, performing that the material you're currently working with. Play is a big component of drama therapy. There's a big emphasis on building spontaneity, increasing spontaneity. If you think of the lifespan and creativity, imagination, and play really diminishes in adulthood and just continues on a steep dive. And with drama therapy, we're really trying to reconnect with the sense of play. And the intention behind that is to help with psychological flexibility. It's been shown that the better able to adapt to situations, the more psychological flexibility and resilience you'll have. And so play can be a really big component of that, that muscle, exercising that muscle. Other processes, drama, therapeutic, empathy, and distancing. So distancing, we talk about how close we're getting to real life material versus how far away from it are we. And drama therapy is all about playing with that distance. So some of the projections might be as simple and sometimes silly as a weather forecast. And then we might slowly get into, okay, why is Josiah reporting that there's thunderstorms or lightning approaching? And then get at, okay, it's because he's doing a presentation today. So that would be going from more distanced to less distanced material. The life drama connection, so connecting that distanced material to more real life situations. And then transformation is where the healing happens. Like, how might you want to see things happen? What do I want to see my forecast in the future be, and how can I get there? So we work on transformation, embodiment. Of course, we mentioned that as being really important. And then therapeutic performance processes. So we'll go into the different theories, and all of them have a performance component to them.
So the integrative 5-phase method, which was created by a very well-known drama therapist, Renee Amuna, is what Josiah and I had the privilege of really studying, getting to know very well as students at the California Institute of Integral Studies with Renee. So what I love about this method is that it's deeply applicable in all areas, from an individual session to a group series. You can use the 5-phase method. Josiah and I, when we're presenting on drama therapy, talk about how the 5-phase method even forms these 15 minutes we have together. So we always start with phase 1, which is dramatic play. So again, as Josiah mentioned, so more distance, we're warming up. This is where the improvisation we mentioned before, some of those games and theater exercises allow the group to come together and get to know each other. Phase 2 is scene work. So we're diving just a little bit deeper, but we're still keeping some distance. In scene work, we're starting to play with scenes from our real lives and giving folks an opportunity to interact and engage together, using scene work as the frame for the relationship that's formulating both in the scene and, of course, outside of that in the process, either in the group process or between the therapist and the client. In phase 3, we go just a little bit deeper. So this is where we're into role play, and we're going to start to introduce, as drama therapists, when we're working with our clients, real life issues or conflicts. So this is where things like, empty chair was mentioned earlier. There's a game we often play, a role play around telephone. If you needed to speak to someone who would be at the other end of the phone, and starting to engage real life role plays so that we're applying this to the client's experience and starting to tackle and support the things that they're coming to therapy for. Phase 4 is culminating enactment. And this is really where the depth of the therapeutic process comes to life. This might be in a self-revelatory performance, which is a deeply kind of personal performance where you invite a select audience to witness your story and the telling of your story. Culminating enactments can also be where a project, an art piece, a movement piece, something comes to life. But it's deeply personal and reflects the internal work of the client with the therapist there to support. And then last but not least is phase 5, dramatic ritual. We're going to have an opportunity to play with this today when we end this presentation, but this is closure. So this is where we really recognize the importance of the session, the gratitude for the time shared, appreciating the client's vulnerability, and kind of tying it all together so that both client, therapist, and group can return back to the world and to life. You can go to the next slide, Josiah. So if you want to learn more about the integrative 5-phase method, Renee just released her 2nd edition of Acting for Real. I really encourage you to read her book. What I love the most about the 5-phase method and Renee's approach is that it's very practical. Her book is filled with exercises that we as drama therapists get to use every single day. And the roots of the 5-phase method, it's important to just know, are deeply humanistic and existential in nature. It's very much about providing a container for the group. Again, the phases allow us to go deeper gradually in a way that's supportive of our clients and where they're at. The games, the exercises, and the phases are all rooted in empathy. So this is all about how we can really create space for our clients, show up, see, and witness them in a very strength-based way in supporting the work that they are there to do. And again, I just do a special shout out to how practical her approach is. And it continues to remain how I think about most things in my life, to be very honest, from my clinical work to how I manage my day sometimes, is what are the 5 phases and how can I make this work and integrate it into my life? Go ahead, Josiah.
Great. And then another big theory within drama therapy, if you think of the 5-phase model being a West Coast centric model because of CIS being in California and that being where Renee developed the model. On the East Coast is role theory with Robert Landy, who developed this theory and taught for many years, just recently retired from NYU with one of our 6 major drama therapy programs. But role theory is all about the person is seen as a constellation of roles. And going back to this concept of psychological flexibility and resilience, it's all about increasing the amount of roles that you are able to step into and step out of and be able to transition from very easily and quickly, so that you don't get stuck with one role and if we're thinking about drama therapy, one story. And saying that, it draws on things you might hear in narrative therapy and other theories of psychotherapy. So often in role theory, you're looking at a particular role. What is the counter role to that? And to bridge the gap between the two, is there a guide that can help you get to that place? So in the groups themselves, you might see that often play out, where people are identifying roles, counter roles, and then a guide to help them move from one to another. That there's a very prescribed way of using role method. You would first invoke the particular role that you're wanting to explore, give it a name, play out and work through the role, explore different alternate qualities and different sub roles that might be present. So really teasing that out. An example here, victim versus martyr might be some examples. Then reflecting upon the role play, relating the fictional role play to everyday life. There again, you see the distancing happening, going from a very distanced approach, because the role you choose might be a fairy tale character, but then connecting that to a real life situation, like where do you become the knight in shining armor and the rescuer in your life, and how is that exhausting you and has brought you to therapy to work through that. So really connecting that to everyday life and how can it help you in that regard. Integrating roles to create a functional role system, and then social modeling, how the roles affect other in their social environments. So again, playing around with trying on different roles to promote growth.
The third theory that we're going to present to you this afternoon is that of developmental transformations, otherwise referred to as DVT. This was really created by David Reed Johnson, and I want to just do a special shout out to the Developmental Transformations website that is such a wonderful resource if you're interested in learning more about DVT in particular. And so I encourage you to visit their website. The link is in the presentation, and we can pop it into the chat a little bit later. But the real premise of DVT is that developmental transformations recognizes that life is unstable. that there's anxiety, and that anxiety is experienced in our bodies and in our relationships to the world. And so DVT really focuses on three key things: embodiment, encounter, and the play space. Josiah, you can move to the next slide. I want to mention that the play space is a special place that the therapist and client enter into, and DVT is very embodied. There's kind of constant physical movement. It is a methodology and a theory that I find hard to describe. I think you learn DVT best by experiencing or witnessing it. Again, if you visit the website, you can see some more about that. But it's all about the interaction in the play space, that contained space, often occurring in groups, but also individually, where transformations occur. So when people enter into the DVT process, you're often initiating movements in response to how people are moving in the group, and you repeat and move together and watch as the embodiment transforms, and out of that will emerge roles, ideas, scenes, concepts, really anything. And the therapist is there to interact and also to help move the transformation through the journey. You can move to the next slide, Josiah. It is a very unique method. I have experienced DVT most successfully in my work with people living with Alzheimer's and dementia, because the concept of entering into the play space, into creating the connection between yourself and the client that is spontaneous, improvisational, and embodied, is a very natural process when you're working with people with advanced Alzheimer's disease. And of course, DVT practitioners are very highly trained. I have experienced DVT from a distance, so I'm very familiar with some of the techniques, and I have deep respect and reverence for it. But I myself do not consider or identify as a DVT practitioner. It's something that takes a lot of time to really train in, and of course, it takes an incredible amount of insight as the facilitator. Both on your own embodied practice, and then how to create that safe space for the client you're interacting with, because the experience can be unstable and fluid and constantly moving and changing. And I have, very deep respect for those who are trained in DVT and are able to hold that space so beautifully. Josiah, would you like to add anything?
What you were speaking about reminds me of emphasizing safety
Yes.
within drama therapy, whether it's the 5-base model, role theory, or DVT. A skilled drama therapist is really able to use these theories in a way that creates structure, and there are a lot of rituals and methods that we rely on to keep each individual safe. I know a lot of obstacles that a drama therapy has to overcome is other practitioners worrying about that piece of safety, and these rituals, the structures, are what we rely on to really create that safe container and be able to I think you mentioned this earlier, bring people out of that play space and shore them back up so that they're able to exit the group in a way that they feel more resourced and better able to move on and work on those issues that brought them to therapy in the first place. We spoke about the core processes involved in drama therapy. I wanted to just briefly touch on, and we're almost out of time, so we won't be able to get into it much, but just some of the research that's happening in drama therapy. The North American Drama Therapy Association several years ago created a research chair of our board of directors in an effort to really emphasize the value of research as we work toward promoting drama therapy as an evidence-based practice. So on our website, we've included a section on educating our members about research, helping them do it themselves, as well as access the base of material that's already been established within the profession. The NADTA has been around for about 40 years. Of course, the profession has evolved long before that. But there is beginning to be a pretty robust body of work in terms of research. And because it's been a lot of work putting together kind of a directory of all the different areas in which drama therapy can be used, I wanted to just highlight that going to our website, you can download a spreadsheet that really describes all the different studies that have happened, some of them qualitative, some of them quantitative, some of them arts-based research, but it really talks about the various populations that drama therapy can be used with, and its effectiveness and what some of the outcomes are. So this is not an exhaustive list, but it is already pretty lengthy. And I just wanted to, again, highlight it as a resource for those. Since we're presenting here in an academic institution, I know there's a big emphasis on research, accessing the research, building upon it. So wanted to just highlight that in our presentation and say that the work is being done to, again, promote drama therapy as an evidence-based practice. And I lost my control screen. Here we go. How do I become a drama therapist? So wanted to start to wind up the presentation here, talking a little bit about what goes into becoming a registered drama therapist. And I mentioned NYU, Kari and I mentioned going to CIIS. Those are two of our coastal master's programs. There's 6 in total throughout the United States and Canada. And I'm talking more North America centric. There are of course worldwide areas to study drama therapy, but in the North America region, it would be a matter of obtaining a master's degree. We do have an alternate training program that is overseen by the NADTA, similar to other professions and licensures. There's quite a bit of experience hours that are required. There's internships that are required. I believe it's 800 experience hours in addition to the studies that you've done leading up to being ready for the work itself. And thinking about where drama therapists work, we certainly have our handful of them here at Langley Porter. I know some of them are here in this Zoom, so I appreciate everybody coming out today. But as you see from this list, there's quite a few areas where you might find a drama therapist, in schools, in shelters, in older adult programs, as Kari discussed, community centers. We have some drama therapists working in San Quentin, residential facilities, nursing homes, all sorts of places. And in terms of practicing drama therapy, the mission of the NADTA is to support and advance the profession of drama therapy. We maintain a registry of people who have qualified for the credential itself through education and experience, which we uphold. I mentioned the NADTA has been around for 40 years, since 1979. And in addition to the credential, which is recognized at various of those sites that I had in the previous slide, as well as places like the VA, which UCSF is associated with. We have a drama therapist at SF VA, who I finished off my supervision with. In various states and provinces are also different licensures. In New York, we have the licensed creative arts therapist, which drama therapy is a part of that licensure. Recently in New Jersey, a license was just passed for being a licensed drama therapist. That's still in the works on its final legs. And then there's the possibility of just being a member of the NADTA for allied professions.
We wanted to mention that as drama therapists, we have a code of ethics that we all follow. Again, you can access this through the NADTA's website if you're interested in learning more. But again, important to just know that as credentialed and licensed therapists, we have our own code of ethics that we follow at the NADTA. And then the next slide, we'll also talk about our commitment to cultural humility, equity, and diversity, which is, again, an integral part of being a drama therapist. And our cultural responsibility guidelines are also available on our website, and you can learn more there. But again, that is something that as drama therapists, we commit to and actively engage in the work that we do in creating community and supporting all people and all abilities.
And I already mostly mentioned the different ways of learning drama therapy, but here are the 6 main universities with our accredited master's programs: Antioch in Seattle, CIS here in San Francisco, Concordia in Canada. Just a couple years ago, Kansas State became our first public university to offer a drama therapy program, Leslie University, and then of course NYU. And I also mentioned the alternative training route. So this might be a good shout out to the AT students, which is often a nice way for current practitioners to really dive into drama therapy. We often see LCSWs doing the alternative training route. LPCCs in different states might be looking into alternative training. So that's a nice way of not having to start all over with going back to the drawing board and starting university studies from scratch. But that might be a nice option for some people who are really passionate about this work, but already established clinicians.
All right. And believe it or not, that brings us to just about the close of our time together. And so in true 5-phase style, we're going to end with some embodiment and practice. So I'm popping this into the chat so that you can follow along. And we're going to do a dramatic ritual closing activity that I personally love and use often in my work called the magic box. So Josiah and I will demonstrate. Everybody else who wants to is invited to join in, and I'll invite you to contribute your thoughts to the chat. So Josiah and I are just going to reach up to the sky and feel around. Josiah, do you feel something up there?
I feel something squirming.
Oh, it's squirming. Oh my gosh. Okay. All right. Let's see if we can. Do you think you can like get your hands around it enough to like bring it down here into this zoomy Zoom room? I think so. Maybe.
I think okay.
All right. Here it comes. We're gonna bring it down. We're bringing it down. And here it is.
Okay.
Oh my. Oh, hello there. Oh, my puppy just came to check out what's in this magic box. Hello there. Very
Your
nice.
real puppy. Your real puppy.
Real puppy. That's right. The one who's on the floor wondering why I'm down here. All right. And what we're going to do is we're just all going to leave something in this box, and we're going to take something with us. So this is where we invite the metaphor, and I invite you all to contribute in the chat. So I'll go first. I'm going to leave here in this space, in this squiggly, squirmy blob. I'm going to leave some exhaustion. And I'm going to take with me a lot of appreciation for the opportunity to present again with my colleague, Josiah.
Aw, thank you.
Pass it to you, Josiah.
I'm gonna leave behind my nerves because I'm not feeling so nervous anymore once I got started. I'm gonna pull out, I will appreciate you, Kari. Thank you for joining me. I'm glad that I'm not solo in this presentation. So I'm gonna take that away with me.
Thank you. Will any of
so
our
now,
friends out there pop anything in the chat for us?
what are you leaving? What are you taking behind or
Something to take with you?
taking away?
And it can be anything, my friends. It can be a word, it can be a sound. I am afraid I cannot see you all, but it could be a gesture if you'd like to gesture out into the space. Leaving appreciation for the presentation, taking some playfulness for the rest of the day. Excellent. Leaving fatigue and taking interest. It's great. Thank you, Jennifer and Beverly.
Someone's going to leave behind anxiety about the future and take with the wisdom that was shared today. Reservations are going to be left behind. Love that. And takeaways: increased curiosity and willingness to try and participate.
Leaving feeling disconnected, taking possibilities of creative combinations. Very nice. Very nice. Taking play and appreciation and leaving crotchety back. Mm-hmm.
That sounds like it might be one of our drama therapists.
Excellent. The idea of the magic box. Okay, Josiah, we're going to contain this magic box and put it back up into the sky as we allow people to look at the references. So, I hope you'll all join me if you can. Can you get your hands under it? It's you know what, it doesn't feel as like squiggly to me as it did before.
I think people took a lot out.
That's kind of nice. Kind of nice to just breathe into that, right? Okay, let's scoop up underneath. Bring it up into the screen. Oh, it's a little heavy, but it's heavy and light at the same time. It's such a cool feeling, hey? And we're going to push it back up into the sky. Ready? 1, 2, 3.
All right. Got it. All right. So we left some references here. Of course, there's a lot that we didn't cover. This was meant to just be a rapid overview. There's more information there on the websites that in particular that those who are interested could explore. And then we have a minute before our end time, but I have more time if it looks like Kari does too. If anybody has any questions for us, we can certainly take a few minutes to explore those.
And I'd like to also thank all of you for your active participation. We really are grateful to have you join us today, and thank you for contributing in all the ways that you did.
And since we are short on time here, I've enabled it so that way people can go ahead and unmute themselves and just ask any questions directly.
That's perfect. Thank you. Also, thank you, Nicholas, for everything you put in the chat box for us.
Oh, absolutely.
Just want to say thank you to you guys. This is Chris talking, and thank you for your presentation and reminding me of the love of drama therapy. It's been a long while since I remembered the 5 phases and the role theory and all that. I'm trained as a developmental transformation therapist, so yeah, that's my shtick. So, beautiful presentation, very well done. Thank you, thank you, thank you. Yeah,
thanks, Chris. Yeah, Chris actually does DVT groups on our adult inpatient program.
Yep.
Amazing.
Pocket play space, you know.
And there has been an occasion where she's also done it for our partial hospitalization and intensive outpatient programs.
Mm-hmm. Yep.
Amazing.
Yep. Yep. It's amazing that we're so varied, that there's so many roads that lead to an embodied way of being, you know, to be able to remember that and refine that. Yeah. Yeah.
Great. Any other questions or comments? Ways in which people are using this? We're curious about ways to use this.
Yeah.
Okay, so let's go ahead and we'll wrap things up since no one seems to have any questions right now. And I'm sure if you do, Josiah and Kari would both be happy to answer them via email or in person if you see either one of them, if we're lucky to actually be in person these days.
Yeah. Here.
I still am known to roam the hallways of Langley Quarter.
There you go.
I'm gonna go ahead and pop my email in the chat. So if anybody's looking to get a hold of me.
I can do that.
Oh, and look at me. I almost spelt my last name wrong. That's no good. There we go. So if anyone would like to contact me with any questions or follow up, I'd love to hear from you and would be happy to answer your questions. And thank you again for this time. And thank you, UCSF, for having me.
Thank you.
All right.
For coming, Kari.
Thank you to both of you for a great presentation. And we will see everyone at the next Intensive Services Grand Rounds. Thank you.
All right.
Bye.
Take care.